All right. So good afternoon, everybody, and thank you all so much for joining us today on what is the third webinar in our sustainability webinar series this year and the last one of calendar year 2024. This webinar today focuses on the importance of social infrastructure for strengthening community preparedness and adaptation to the health challenges associated with climate change. My name is Peter Boger. I'm the Director for Engagement at Penn State Sustainability. If you're hearing any noise in the background, that is my dog Rocky deciding right now to start to tear apart the apartment. We're so delighted that you all are here today for this webinar series, which is a partnership between Penn State Sustainability Office and the Pennsylvania Green Gov Council. I'm with Penn State Sustainability. We are the Office for the Chief Sustainability Officer at Penn State. Our job is to not be the owners of sustainability, but rather the connectors and catalyzers for sustainability across Penn State's entire 24 campus system. All of our teaching, our research, our engagement with students, our operations, and most importantly, our service to Pennsylvania and the communities in our land grant mission. And in this, we recognize that we need partners, and we are delighted to be continuing in this, our sixth round of partnerships with the Green Gov Council. And I will give either Matt or Mark an opportunity, I forget which was going to hop on, just to talk a little bit more about their focus and their mission.
Yeah, and thanks, Peter. And the Green Gov Council has specific climate goals for Commonwealth agencies for the reduction of greenhouse gas emissions within our portfolio, and a component of reach out, such as and partnerships such as this one with Penn State Sustainability. And with that being said, we're very happy of the webinar series. We can't even believe that we're in the sixth series going forward, and all of them are on the are all housed on the Green Gov website, of which this one will be as well, and folks will receive a link to the recording when the recording is done. And we just want to thanks for all of the participation throughout the years, and certainly proud to keep it going. And thanks again, and back to you, Peter.
Thank you so much, Matt. And as we've mentioned, one of the goals for this webinar series is really to build partnerships, not just between Green Gov and Penn State, but hopefully with all of you all on here. We know that these webinars have attracted people who are from state government, county government, municipal government, from universities, nonprofits, community groups, businesses, and we are delighted to have you all here learning about the breadth of what is sustainability and maybe expanding your vision of what that is. Also understanding more about what is happening in Pennsylvania. Great case studies, great opportunities, and just broader awareness of the issues. And one of the key things we know is that sustainability issues are wicked problems, because the more you unpeel them, the more you see that there are all these hidden interconnections, that one subject, health affects housing, affects climate, and vice versa. And so with that, we also want to see that those are opportunities. You are not alone. There are opportunities to build partnerships with people, maybe not in your field, but who are considering the same kinds of issues. And our topic today is a prime example of this, with the importance of social infrastructure for strengthening community preparedness. We are incredibly honored to have two very distinguished speakers who are going to present to us today. First up, we have Dr. Erica Husser, who is an assistant research professor in the Penn State Ross and Carol Neese College of Nursing. Her research, Resilience and Equity in Addressing Climate Health, is supported by the Penn State Climate Consortium, where she also serves as a faculty advisor. Dr. Husser is a gerontologist and faculty affiliate with the Tressa Neese and Helen Diskovich Center of Geriatric Nursing Excellence, and most recently served as project director for a 5-year geriatric workforce enhancement program in the College of Nursing called Age Friendly Care Pennsylvania, a program supported through the Health Resources and Services Administration. Next, we have Dr. Christina Brandt, who is an assistant professor of rural sociology at Penn State and a co-funded faculty member of the Social Science Research Institute. She is a sociologist engaged in community-engaged work with the goal of informing policy and practice to support the vitality of rural U.S. communities. Her core research program concerns the social and structural factors that increase or decrease the risk for substance use-related harms. Her current projects explore the impacts of broadband expansion on substance use treatment access, the impacts of extreme flooding events on drug overdoses, the impacts of the opioid settlement in Pennsylvania, and access to medications for opioid use disorder and harm reduction services in rural Pennsylvania. With Penn State Extension, Dr. Brandt puts this research into practice through community-based programming in rural Pennsylvania communities. I can think of no more distinguished and well-versed guests than we have today, and we are delighted to turn the floor over to Erica and Christina for their talk. Thank you so much for presenting today.
Wow, Peter, you're very kind. Thank you for all your kind words and your leadership here. And also, I really appreciate, I just want to shout out to you, I really appreciate the constructive dialogue that we have had that has led us to this point. So thank you very much. Share, let's see if I get this right. Are you seeing yourselves or are you seeing the right screen?
See your notes too. I don't know how to move that over.
Are you seeing the presentation screen?
We're seeing the presenter screen, and also I think you shared your desktop, not the.
Yeah, let me see if I can. I'm sorry, I rehearsed this. I promise I rehearsed this.
It always works in rehearsal. It doesn't in the real thing.
Yeah. So let's see. Share. Okay. Success.
Perfect.
Success. Excellent. Okay. So I will advance to our objectives. Let's dive right in. Today, we are going to talk about defining social infrastructure and its relationship to health. That's our first objective. Our second objective is to explore aging, vulnerability, risk, and resilience, all related to climate change and health. And then third, we'll provide some methods and examples for strengthening social infrastructure, again, with an emphasis this time on intergenerational approaches. So Christina will start us off and answer this question about what is social infrastructure.
All right, thanks, Erica. So in this presentation, we're going to be making this case for the importance of having robust social infrastructure for building climate preparedness and resilience. So I'm going to take a step back first and just provide an overview of what we mean by social infrastructure and how that relates to health. So social infrastructure consists of the systems and the facilities in a neighborhood or a community that are facilitating social connection between people. And social infrastructure doesn't necessarily have to be like a physical place, right? Virtual programs that connect people are also a form of social infrastructure. But a really important component of this are those physical locations for gathering, and that we typically call third places. So third places are these specific physical locations outside of people's homes and outside of people's places of work where people come together and interact. So sometimes these kind of third places exist solely for the purpose of promoting gathering, like a community center. But there are also types of third places where they're ostensibly for a different purpose. For example, a barber shop where people come to get their hair cut. But those places can also serve this secondary purpose of bringing people together and facilitating interaction. So if you can go to the next slide. A close colleague of mine here at Penn State, Danielle Rubar, has done a lot of work on social infrastructure and health, and she recently laid out a typology of third places. So she and her team describe 5 types. The first type is free and publicly available third places. These are things like libraries and places of worship. The second type is social service organizations that are free, but their primary purpose is to connect individuals with resources, like think of a food pantry or a child care center. And then the 3 remaining types of third places are commercial spaces where typically to gain access, you have to purchase something like a good or a service. So these could include food and drink establishments like restaurants and bars, gyms and theaters, places of entertainment or athletics, and then finally personal service establishments like barbershops and salons. So these different types all, similarly promote social interaction and cohesion, but the latter 4 types are more limiting as to who can gain access or who would seek access. Next slide. All right, so we can all kind of imagine that a town or neighborhood with social infrastructure is going to feel more vibrant. But research actually confirms this, right? We've found that social infrastructure is associated with higher perceived quality of life and higher community satisfaction. In one recent national survey, a team of researchers found that people who perceived third places as more accessible in their communities also perceived a higher quality of life in their communities. And this trend has especially been noted among older adults. There have also been a few recent interview studies that talk to older adults, and these studies have found that third places provide older adults especially an opportunity to interact with others, and that this creates a deeper sense of connection in their communities and also a more positive perception of their communities. But beyond just kind of improving like community quality of life, we also know that robust social infrastructure is connected to individual health outcomes. What that means is that social infrastructure literally promotes individual health. So this is in large part because social engagement is so crucial for physical and mental health. So first, in terms of mental health, right, research has shown that feelings of isolation and loneliness have really large negative consequences for our psychological well-being. So isolation and loneliness are associated with higher rates of things like depression and anxiety and suicidal ideation. So insofar that social infrastructure can help facilitate connection and decrease this isolation and loneliness, it's going to promote better mental health. And I want to highlight a recent study led by another Penn State researcher named Shui Zhang that clearly demonstrates this connection. So she and her team use a data set that has counts of the types of social infrastructure present in neighborhoods, and they connect this with place level mortality data. And they find that suicide rates are significantly lower in counties that have more social infrastructure. And this is even after controlling for things like the age distribution and the income distribution of those places. But social infrastructure doesn't just impact mental health, it also can promote physical health in a few ways. So for one, mental and physical health are connected. So research has shown that social isolation can increase the risk of cardiovascular disease. But when people are connected to others, it buffers stress and thus reduces stress-induced cardiovascular reactivity. But second, social support can also help people just reduce and manage their health risks. So I recently conducted research in a small rural community here in central Pennsylvania, and my team found that when people have neighbors and other community members who can offer support, that they lean on them for things like rides to healthcare appointments. And that's a really crucial component of healthcare access. Third places are the spaces where those relationships are created. So it's a mechanism by which people can form these ties that will help them access healthcare. And then three, third places also simply provide emergency support in the face of climate challenges. We're going to dive into this a little more later, but to give you a sneak peek, when temperatures drop in the winter, when they rise in the summer, third places often open their doors to people to provide emergency shelter. And so through these mechanisms, social infrastructure is really crucial for both short-term and long-term mental and physical health. But despite this really clear connection between social infrastructure and health, research has been showing that social infrastructure is declining. So these graphs I show here are from a recent study that utilized business microdata for 60 million businesses across the US. And they found that starting with the Great Recession in 2008, the overall number of establishments started declining. The decline was especially striking in grocery stores, personal services, and religious establishments, right? These graphs show that some of these types of establishments dropped as much as 20% since 2008. And while we're seeing these declines overall, you can go to the next slide, Erica. The loss of social infrastructure has been especially a common theme in rural places. So population decline, disinvestment, and persistent poverty simply has made some of these places less economically viable for institutions. So earlier I referenced a study by my colleague Danielle that laid out this typology of third places. And in this study, her team looks at how third places are distributed across the US. And they find that rural neighborhoods have shorter supplies of third places than urban neighborhoods. This is per capita, not total overall number. And they found that this was especially the case for rural areas that have larger shares of lower income residents and larger shares of non-white residents. I'm part of a group called the Rural Population Research Network, and that consists of rural population researchers across the country. And we recently conducted a series of listening sessions with about 80 rural practitioners across the US, and many of those were from Pennsylvania. And our purpose was to simply ask people, what are the community needs and trends you're seeing that you want researchers to delve into? And one of the top areas of discussion was concerns about this declining social infrastructure and what that meant for rural people, right? People across the country were telling us they were seeing community establishments disappearing, and they were noticing that this was creating kind of spirals of decline, right? So losing these establishments would then like further incentivize people to move out, and it would disincentivize people from moving in. And they were really concerned what that meant for people who remained. So overwhelmingly, we know that social infrastructure is important for health, but we're seeing these declines and concerns about what that means. So with that background, I'm going to pass the mic to Erica, and she's going to take a closer look at what this means for Pennsylvania.
Thank you, Christina. That was excellent. And I would encourage anybody who has questions to just jot them to the side. I know sometimes we race through these things so quickly, so please feel free to take a minute and breathe and write down some questions if you have them. So yes, I'm going to talk about Pennsylvania specifically, and I'm going to start by just looking at the demographics. This is U.S. Census data, and the pyramid graph shows the age and gender distribution of men and women in Pennsylvania in 2024. In total, there's about just over 13 million people who live in Pennsylvania. We're ranked 5th in the United States for the size of our older adult population, and we're 8th in terms of the percentage, with those 65 years of age or better accounting for about 20% of the population. Also, in 13 years, so since 2010, Pennsylvania's total older adult population has grown by about 4%. So it was 15.5% in 2010, and in 2023, it was 19.5%, almost 20%. And it's expected to increase in size exponentially. And as you can see, there's a bit of a bulge there. We all know by now that that bulge is our baby boomer generation, defined as those who were born from 1946 to 1964. And by 2030, it's forecast that 1 in 5 Pennsylvanians will be 65 years or older. And there is real valid concern that our systems, services, communities, and families are not ready. And there are exacerbated concerns for those living in rural areas. So let's turn our attention for a moment to rural Pennsylvania. There is a growth pattern that's been happening since about 1970. And what we're seeing is a decline of young people in rural areas and an increasing number of older people in these rural areas. And one more graph I'd like to show you is, I really like this one because it quickly illustrates the flavor of where the highest number of older adults to younger people are living. So the green counties are where the number of older adults outnumber the youth, and vice versa. The white is where the youth outnumber seniors. So we'll see that there's in sort of the western side of the state, it's old and getting older, perhaps potentially quicker than in other areas of the state. Now, besides the obvious concerns about the capacity of the workforce, civic life, and family care provision, there are specific health considerations. Living in rural areas is more challenging for older adults, and here's just one reason why. And this just paints a bit of a health picture for you. Chronic conditions are common, and thanks to the miracle of modern medicine, we are all blessed to be living longer lives. And at no time in history have we enjoyed this old age. It's unprecedented. So it's great that we're living longer, but we are living with chronic conditions. And I won't go through the graph, but you can see where the percentages lay in these different chronic conditions. And then it's anywhere from about 30% to 80%, depending on where you're looking at the data. Those are the number of people that will have multiple chronic conditions. And depending on how many chronic conditions you're living with, that can really tax the healthcare system. And we have various challenges in the United States with our healthcare system. Most recently, in a study at Penn State, Dr. Stephen Hess has found that later born generations of older adults in the US are more likely to have even greater number of chronic health conditions too in the United States. And also life expectancy has been declining in recent years. So we are not a healthy nation and we're not getting any healthier. So again, thinking about rural areas, I'm going to pull it back to rural areas again. I got carried away, but older adults in rural areas have less access, as Christina was mentioning, to social infrastructure, and they have limited opportunities for social engagement. Rural older adults live with more comorbidity and polypharmacy. About 23% have cognitive difficulties and difficulties living independently. Exacerbating these health disparities are then challenges associated with the social determinants of health. That's including limitations to transportation, lower average health literacy and income levels, limited access to affordable housing and reliable technology, such as broadband internet service, and difficulties accessing healthcare services. So those are some of the challenges. What are some of the solutions? Well, we'll talk about solutions in a moment. First of all, how does this look in the context of climate change? And how is climate change influencing health for older adults? And this is just a quick snapshot, thanks to the Pennsylvania Department of Health for this data. I know I'm sort of preaching to the choir, so I'll go through this quickly. We have poor air quality is on the rise, extreme heat events, pathogen vector distribution, extreme weather events, precipitation extremes, food safety and/or insecurity. All of these things are happening in all of our communities. The most dangerous, perhaps the most dangerous situation is extreme heat for older adults. And I want to draw your attention under extreme heat. I want to draw your attention to one statistic. In the past 20 years, there has been a 54% increase in heat-related mortality and people over the age of 65. And for some people, it might be obvious why, and others it may not be. So let's think about why older adults are at increased risk. As mentioned, we're living with multiple chronic conditions, and that in and of itself predisposes you to risk. Your system isn't as robust or resilient from a physical standpoint. And because you're on multiple medications, or your medications can be influenced by heat as well, makes them less efficacious. If we think about the psychological aspects of aging, there are mental health concerns. Depression is very common among older adults. And then sociologically, interpersonal relationships are really important, and those decline over time. Social support dynamics are definitely come to play when we think about access to resources, and if there's somebody there to help you out, as Christina mentioned, having somebody who can take you somewhere to the doctor's appointment is really important. It sounds simple, but if you don't have that, and transportation in rural areas is really limited, public transportation that is. So these are all some of, and these are, I'm just scratching the surface, but that's some of why older adults are at risk and for the negative health effects of climate change. And with that, I'd like to pass it back to Christina. She has an excellent case study to share with us.
So there is one really quintessential study that demonstrates the connection between social infrastructure and climate-related health vulnerabilities, especially among older adults. And I think that showing this example will just kind of help to show how the concepts we've talked about play out in a real-life case. So in his 2002 book, Heat Wave, the sociologist Eric Kleinenberg presents a really detailed account of a week-long deadly heat wave that took its toll on the city of Chicago in 1995. So all in all, the heat wave ended up leaving 485 people dead due to heat-related illnesses. Erica, can you go to the next slide? And in general, through his study, Kleinenberg noted that deaths were clustered in poorer neighborhoods that had higher proportions of older adults living alone. And he identified 4 conditions that he saw contribute to this. So first, he learned that there were simply greater numbers of older adults living alone, especially with physical mobility issues. And then second, he found that in these neighborhoods, there tended to be perceptions of increased crime and also just a culture of individualism and self-sufficiency, and that these two things together led people to be less likely to reach out to one another. He also noticed that there'd been this spatial transformation of neighborhoods and that houses were being built in a way that decreased natural opportunities for interaction. And finally, he found a gendered condition. He saw that there was a growing tendency for older single men, especially, to kind of lose crucial parts of their social networks. Next slide. Kleinenberg also noticed something else, though, and this is what makes the case that we're trying to give you today. Within this overall pattern, he saw remaining variation. So he selected these 2 very similar neighborhoods, North and South Lawndale, that literally neighbored one another, but they had extremely disparate death rates. As you can see, one had 40 deaths per 100,000 residents and one had 4. And Kleinenberg found that the disparity in death rates was really due to the difference in social infrastructure in the two neighborhoods. So during the heat wave, the city as a whole had kind of failed to provide resources to residents because it didn't realize how bad this heat wave was going to be. And as a result of those failures, residents in North Lawndale really suffered. But South Lawndale residents fared a little bit better. And Kleinenberg found that this neighborhood had a really vibrant and inclusive community where residents had a high rate of social connectedness. He found that community members had checked on each other, especially their older neighbors. Local businesses were well connected to the community and they opened their doors up to people in need. And these social support networks, cultivated by the social infrastructure, helped to reduce devastation there. And I know this is an older example and it's one type of extreme weather event, but it certainly has implications for today. So those four vulnerabilities which Kleinenberg saw, they've continued and if anything even intensified in recent years. So as Erica explained earlier, right, Kleinenberg saw this trend of greater numbers of older adults aging in place, and that's expanded, especially in Pennsylvania. The other trend that Kleinenberg saw, that spaces built into communities, that there were fewer of these spaces that naturally created opportunities, that's expanded. And then we may not necessarily see concerns about violent crime across Pennsylvania, but my own work has suggested that there's something similar happened in relation to the overdose crisis. So I've done a lot of work in communities that have been deeply impacted by the overdose crisis, and I've heard residents talking about withdrawing from one another due to this increased fear, increased distrust related to fear and stigma of substance use. So there's evidence that these vulnerabilities are continuing, that they're making communities susceptible to harm in the face of extreme weather events. And this is why social infrastructure is perhaps more important than ever.
So it begs the question, why? Why do we have such limitation in our social infrastructure? Why is it on the decline? Why are we set up this way? Why are we so age segregated? There are probably quite a few different reasons. And the one I'm going to focus on right now is ageism. And some people think ageism is the last ism that needs to be tackled. That's possible. I think that defining ageism is pretty important. So it is a stereotype. Let's see. Ageism is let's see, it refers to the stereotype. So how we think, how we feel, the prejudice and discrimination, how we act toward others or oneself based on age. Ageism is unidirectional. It can be interpersonal, institutional, and it can be internalized. Ageism is associated with quite a few negative outcomes. So earlier death is one, and ageism can be linked with things like poor physical health, impeded recovery from injury or disability, increased risky behavior, accelerated cognitive impairment, poor mental health outcomes, and reduced quality of life. So, in one study of older American veterans, those who resisted negative age stereotypes were found to be less likely to experience suicidal ideation, anxiety, and post traumatic stress disorder. So, anti-ageism is a protective factor. And how do we get there? Well, what are some solutions? I think we have to change the way that we think, feel, and act. We need to understand our own biases, include anti-aging efforts as part of the other isms that we're addressing, and then get involved. And there are a lot of ways that you can get involved. You've probably heard of quite a few different age-friendly movements. There's the Age Friendly Cities and Communities Initiative, which is a program of the World Health Organization. It's being led in part here by AARP. There are 9 Pennsylvania counties that have been recognized as an age-friendly community. Right there you see the 8 domains of livability. I won't go through them all as we don't have all the time in the world, but it does point to outdoor spaces, housing, transportation. Maybe I should mention all of them. They're all very important. Here we see social participation, respect and social inclusion, communication and information, civic participation and employment, and then health services and community supports. And some of these domains are going to look a little bit different depending on the movement. The next movement I'd like to share with you is the age-friendly health systems movement. This is the one that I was involved with for 5 years. And as a result, the College of Nursing has some great resources, and I'll put our link to our website in the chat in a moment here. But we have online learning modules that have been used by thousands of students and healthcare professionals. And we're trying to disseminate this framework to improve the quality of care that happens in various healthcare centers by all different kinds of healthcare professionals. And one of the things that we're finding is that, geriatric care is also environmentally friendly. Using fewer medications is environmentally friendly. It reduces greenhouse gas emissions. I could go on, but I'm going to keep moving there because there's another movement. There's also an age-friendly age-friendly universities movement. And Penn State is actually having, thanks to the leadership at the College of Nursing and HHD and various other partners across the university, we have an application to become an age-friendly university, and it's on the desk of the president as we speak. So we're hoping to hear that by the new year. Penn State will be the second university to become age-friendly in Pennsylvania. And of course, it's all part of this age-friendly ecosystem. Cities, communities, workplaces, it's a public health issue. And one of the things that I'm really trying to do right now in my work with the Climate Consortium is to push the envelope on age-friendly health systems, to really consider it as, to put it in the context of climate change. So we can start thinking about climate change when we think about the care of older adults. Now, one of the beautiful ways that I see that we are sort of the nexus of all of these issues that we're talking about, social infrastructure, ageism, the need to be civically engaged, to have good health for the planet, is a third space that are called resilient hubs. Now, these are fairly new. Uh, I think about 2020, the late night 2019 or so, resilient hubs began to sort of emerge, and they have 5 foundational areas within a hub. And this is these 5, because it's kind of like the Wild West in some ways, these resilience hubs. There's not a ton of research available on them, but there is a lot of work. And what I'm going to share with you right now comes from the Urban Sustainability Directors Network, which includes directors from both Canada and the United States. It's a great organization, and they've identified 5 foundational areas that are served by a resilience hub. You need to have services and programs, right? With the highlight being to build relationships, to promote community preparedness, and to improve residents' health and well-being. This is social infrastructure. The other elements are communication, building and landscapes, power, and operations. So these hubs will function under 3 different operating conditions too, right? They're going to be open and operating on a daily basis. And then also they need to be open and operating when there's disruption, and then in a recovery mode. So of course there are challenges. It is still new, and there are a lot of challenges, transportation being one of them. That doesn't change. How do you get people from point A to point B? But this does show a lot of promise for being a great solution. And from a climate perspective, what we're going to see you see on the roof here, we have solar panels. So they have to be self-sufficient, so they stay open. They have to have supplies. What is the one thing I'm getting carried away here and I'm not following my notes. There is growing support for these resilience hubs, and we will be doing some more exploration of these for potential solution as part of our potential solutions to address. And they look vastly different. In Hawaii, there is not just one hub in Maui, but they have, I think, 8 or 10 different hubs, and they act as a network. So they just look vastly different. And then in Baltimore, there's one in downtown DC. And I know what I was thinking of before is that these aren't necessarily a great solution for rural areas. So there are going to be challenges depending on the geographic location and the community composition. So I'll leave that there and turn it back over to Christina.
So what we wanted to contextualize this information with is that we recognize that these are really, really big endeavors, and right, they require time, money, and effort. So we wanted to underscore that there are other interventions that can spur greater connection and cohesion that have a lower bar to implement. And so these can be an important facet of trying to do this work today as well. So we want to introduce a few examples specifically of intergenerational places and programs. So intergenerational practice, I provided a definition here. It aims to bring people together in purposeful, mutually beneficial activities which promote greater understanding and respect between generations and contributes to building more cohesive communities. So I want to highlight that intergenerational practice differs from multi-generational practice. It's kind of like a subset as I see it. Intergenerational practice intentionally facilitates people of different generations to work together, to share, to learn from one another. While multi-generational practice is inclusive of people across different generations, it makes sure the opportunity is open to people across generations, but it doesn't necessarily fuel those connections. And there are definitely spaces that are, primarily dedicated to being intergenerational, but intergenerational practices can also be woven into other spaces. They can be found in schools, parks, libraries, education centers, community centers, and so on. So we wanted to provide a few examples of what these look like. Erica, you can go to the next slide. So one example I found from Vancouver, Canada, the framework is put into practice in an intergenerational garden. It's a neighborhood-based initiative where younger and older adult volunteers come together to teach students about gardening. And I've included in the slide a toolkit from Generations United, which outlines how communities can start an intergenerational garden. These slides will be shared, so you can click on the link if you're interested. Another example from Ohio is that of an intergenerational reading room. It's an intentional space that can be in a school or a library, which facilitates younger and older adult volunteers and building students' reading skills. So I've also included a link to a toolkit from Penn State Extension on how to create those spaces. And then finally, here in Pennsylvania, there's this great initiative formed between the Department of Aging and several universities called the Intergenerational University Connections Program, and it connects students and older adults. So the program ensures that both of the members of these pairs have an iPad and know how to use it, and the pairs keep in contact with phone calls and video calls. And the participants of the program have said that they feel like it's helped them build connections and reduce those feelings of isolation. And then finally, I want to note that a colleague of mine here at Penn State, Matt Kaplan, specializes in intergenerational practice and research, and he's developed a wealth of resources on the through Penn State Extension that can help Pennsylvania communities build intergenerational places and programs. So I've also provided a link in the slide to his page, which is called the Penn State Intergenerational Program.
Thanks, Christina. And also, Dr. Kaplan is also a colleague of mine, and I just wanted to, he has a great book out right now, which is called Intergenerational Contact Zones, and it brings focus to how to develop those as well. And he started the Pennsylvania Intergenerational Network, as you mentioned, right, Christina? And there's a monthly newsletter that goes out. They're coming to there are, annual, now there are annual conferences. So it's a great way to get involved. I think let's wrap up, and Christina, feel free to jump in at any point here as we just wrap up and finish talking about next steps or moving forward. I want to just say that I think we need to it's beginning to happen in some ways, but in others it's not. But we need to galvanize our existing systems to reduce age segregation. We need to reframe aging and reduce ageism so we need to build civil society, enhance these intergenerational civic engagement opportunities. And then we haven't really talked about this, but in terms of the built environment and experiences in the natural environment, we need to infuse these things into our work, our lives every day so that we can build an understanding, we can build concern and engagement and stewardship across the life course. Other things, we need to continue to build bridges and work across silos. And I'm really excited about the work that I'm seeing going on right now. I think there's a lot of energy and effort of people trying to work across these silos. So let's keep at it. Let's keep doing that. And then just continue to raise awareness and about whatever strikes you to be most important in your life, in your family, in your community. There's plenty to be concerned about, but pick something, maybe one or two things. Find a local organization that, maybe you have an hour a month to give. That's a lot for a nonprofit organization, so you could get engaged there. We need to look at improving preparation and mitigation. We need to educate current and future workforce sectors and then continue to research, teach, and encourage adaptive strategies. So with that, I think, Christina, do you want to add anything? Perhaps
Nope,
I've said
I'd
too
like to
much.
dive into questions. This was
Yeah.
great. Thank you, Erica.
Thank you, Erica and Christina, so much. Gave us so much food for thought here, and so many different realms, from what is social infrastructure to third places to the climate intersections to ageism to solutions like resilience hubs. I will say again, if you have questions, please feel free either to put them into the chat, and we have some ready that we'll start out with. Also, feel free to click the raise your hand button.